So atrial fibrillation is one of the most common arrhythmias in the world. It's a prevalence of approximately 1 to 2% worldwide, and we're expected to have as close to 12 million people with atrial fibrillation by 2030. So as you can imagine, something that's quite prevalent. About 1 in 4 people end up having a lifetime risk of developing atrial fibrillation, and basically in a normal heart, you would have a very nice organized rhythm. When someone has atrial fibrillation, the top chambers of a heart are very chaotic in signals. And what that translates into is irregularity and sometimes fast heart rates in the lower chambers of a heart. These can easily be diagnosed through electrocardiogram or EKG. These are almost readily available in all physician offices. And I do encourage people to talk to their doctors about this once they find out. There are various treatment options that we offer for our patients here at St. John Medical Center. We typically first start off by talking to them and understanding their arrhythmia background. Following that, we do tailor our management towards them. So there are different options, including that of medication control versus procedure-based, something called a cardiac ablation. It is a minimally invasive procedure that we perform over here, where we pass catheters up through into the heart, and we basically either burn or freeze in strategic locations within the heart. And the idea is to try to treat for the atrial fibrillation and keep at a very minimal burden. One of the things that we always try to prevent with atrial fibrillation is first and foremost stroke. With atrial fibrillation, people have up to as high as 5-fold the risk of developing a stroke, in addition to other comorbidities like that of heart failure. So when it comes to risk factors with atrial fibrillation, there are modifiable risk factors and things that we can't really control. So some of these risk factors may include obesity, excessive alcohol use, sleep apnea, smoking, sedentary lifestyle. And then there's also the other factors such as advancing age. With older patients, the likelihood of developing atrial fibrillation is going to be higher.